In this video, I will review the 5 most common pelvic health symptoms during pregnancy. But before we get started, make sure you subscribe to my channel and click the bell button below so you don't miss any of my pelvic floor tips to prepare for an empowering birth and full postpartum recovery. So the first common pelvic health symptom is urine leakage. And this typically starts in the 2nd or 3rd trimester when you start having a little bit more weight from your baby right on that bladder. And the leaks can happen, during sneezing, coughing, on the way to the bathroom, or sometimes even at random moments. Having a few drops of urine leaking once in a while on a full bladder when you're sneezing is not a concern. But if you have to wear panty liners and pads because of daily leakage issues, I would definitely recommend consulting with a pelvic health physiotherapist. The second pelvic health symptom during pregnancy that is the most common is painful sex. So in pregnancy, it's quite common that the frequency of intercourse may decrease for a little bit as, maybe you feel nauseated, you're tired, or you're just simply not into it with all the hormonal changes happening. And this is completely normal, so don't blame yourself if that's your case. So what happens when we have less frequent penetrative sex is that the pelvic floor muscles can become tight just from the lack of being used, basically, and being stretched out. So that can make the vaginal opening smaller, and that can cause pain with sex, as if there is not enough space for the penis to come in. So if that's your case, I would suggest watching my video in the description below about dilator work to stretch the vaginal opening, which will be also beneficial in your preparation for birth. The third most common pelvic health symptom during pregnancy is vaginal heaviness. So with the increased weight of your baby on your pelvis and also the relaxin hormone that makes everything looser in your body during pregnancy, some women will report feeling like their insides are falling out or that their vagina and pelvic floor is feeling lower than usual. So wearing a belly support belt can help at decreasing the impact of your baby's weight on your pelvis and just relieving some of that pressure, but also just listening to your body, right? Like if midday you're starting to feeling heavy down there, maybe like just lying down to help gravity to have less impact on your pelvis, and taking breaks, right? So trying to not stand for hours at a time if that is possible for you. Symptom number 4 is urinary frequency. So it's normal to pee more frequently during pregnancy, providing that you're keeping yourself well hydrated. For non-pregnant individuals, the normal frequency to visit the bathroom is every 3 to 4 hours. But during pregnancy, it can easily get to every 2 hours and still be normal. But if you're peeing every hour or less, it is definitely not normal, and I would recommend to consult with a pelvic health physiotherapist if that is the case. And the last symptom is peeing at night, which we call Nocturia in a more scientific term. It is normal to pee at least once a night during pregnancy, but if you have to get up more than once a night to visit the bathroom and it disturbs your sleep, you may want to check on your liquid intake in the evening and make sure that you stop drinking 2 hours prior to bed to avoid peeing too often at night. And you will also want to avoid drinking through the night, so no water bottle on the bedside table. I know for myself, being pregnant right now, that I'm not super good at drinking water during the day, so I end up catching up at night, which explains why I get up so often to pee. So making sure that you stay hydrated throughout the day can be a solution to explore, but I know it is hard when you're a busy person, and I'm the proof myself. I know the solution to my problem and I still don't do it. But if you're more dedicated than I am, maybe it'll work for you. If you enjoyed this video, please make sure you give it a like to support my channel, and I hope you will share it with your pregnant friends. Thanks for watching.